Oh yeah, you're on.
Okay, we are on. I hope it wasn't too bad.
Okay.
All right, well, good afternoon. Sorry, we are a little bit late. So we are, okay. So, yeah, one other thing here. Sorry, guys. Today was a little bit challenge. So I'm not sharing my screen right now, so we are good. Okay, I'm gonna go ahead and start. I'm so sorry we are a little bit late. We had, as most people have, a little bit technical difficulties. Today is October 14th. We are here on our live educational session for bariatric. This is our volume 7. Today we are gonna discuss the maintaining weight after bariatric surgery. I have Dr. Isaias Irgau with me. As usual, he's gonna be talking to us about the specific issue that we have. And then prior to that, I do wanna actually just kind of walk you through with our program so that everyone is kind of, I know most of you are already following these events, but I still want to make sure that you are able to see what we are doing now. I'm going to start with Dr. Irgau. Dr. Irgau, can you please introduce yourself first?
Thank you, Kemal. Hello, everybody. I am Dr. Irgau. I am the president of CHRIAS, the Christiana Institute of Advanced Surgery. My specialty is bariatric surgery or weight loss surgery, and I have been performing weight loss surgery for close to 20 years now. I'm very happy to be here this afternoon.
All right. So, Dr. Irgau, since now we know who you are, I'm going to go ahead and introduce myself. My name is Kemal. I'm the chairman of American Surgery Center as well as United Medical ACO. We are trying to adopt these types of events as part of our business culture and clinical culture. So we're hoping that we can make this happen every week. We have done so many events so far. I would like to also introduce our other surgeons in the program, Dr. Irgau, Dr. Gail Wynn. She's been with us for almost 20 years now. Dr. Mike Peters, he was my guest last week. Many of you who watched the event, you would know him. Dr. Rahul Singh is another one of our surgeons on the bariatric, and Dr. George Ibrahim are on the bariatric surgery side, our surgeons. Also, we have colorectal surgery with Dr. Sachin Wade, and then also our surgical PA, Sydney Manbeck, is also part of the program. Mainly, we do procedures at Christiana Hospital, St. Francis Hospital, but our home base is American Surgery Center since April 2018. So now today I wanted to introduce our team. So many of you who start the program, you are probably dealing with them. So we have Rika and James in the business office as care coordinators. They cannot see the PowerPoint, so I will fix that right now. I'm so glad everyone is watching it. So, all right, so we are okay now. What does that mean?
It's delayed. I can't.
Oh, delay is fine, but as long as I'm sharing. So I had this signal. I don't know if it was in between, but apparently now it should be on. Michelle Ciano is our director of nursing in the program, and Melissa Demat is our program director, program administrator at CHRIAS. Now, other people that you would know from the program is Bambi, Hannah, Francisco. They're one of the care coordinators, and we have 4 others in the program, but we were able to get their pictures. Next time I will share the others. Now, I also want to make sure that we emphasize our accredited diabetes center, so that everyone is also familiar with Fran, Amy, and Beth. They are our registered dietitians. They are part of the program since the beginning. They are actually one of the most essential part of the program, as they are providing the support for our patients on a regular basis. Now, Dr. Irgau, from here, I do want to make sure, because there are some of our followers, they actually just started this week. There are some from the prior time. Just for those who may not know, from the experience in bariatric surgery, center of excellence, what makes someone a better surgeon, why we are so much more confident than any other group in, not in the state of Delaware, but probably in the United States. If you can just give us the background and then just elaborate that a little bit.
Absolutely, absolutely. So bariatric surgery is a specialty where the surgeon really focuses their main expertise in weight loss surgery. And weight loss surgery includes a number of procedures that are geared towards making changes in the digestive tract through surgery. The surgery that is performed nowadays, Kemal, as you know, is done through minimally invasive approach, which means we do really complex operations through small incisions so that the recovery is very fast after the surgery. And many of the complications that our predecessors used to see because of the big incisions that they had to make to do the surgery, obviously we don't see. In order, obviously, to become really proficient in this experience is very important. And as you correctly mentioned, we have been performing this surgery now to close to 20 years. We are by far the most experienced group in our area, and we've really taught many surgeons over the years when they first started to perform bariatric surgery. We have a number of firsts, including the first laparoscopic gastric bypass, the first laparoscopic sleeve gastrectomy, the first lap band in our area, which is not only in Delaware, but also, as you know, the surrounding counties from the surrounding states, including Pennsylvania, New Jersey, and Maryland also are included, as we really see many patients from those areas as well. So we've been performing the surgery for many years. We've really refined this expertise to make this complex surgery very safe, and obviously our outcomes speak to that. But it's not only about the surgery, as you know, it's really about a question of how we prepare patients and how we follow them up afterwards, which leads really to the topic of today's discussion is how do we really help our patients maintain a long-term success with weight loss after their surgeries.
So Dr. Irgau, while we are going through our subject matter for today, I do want to make sure that one of my goals for us, for our patients, that they can actually find these events offline, but online, but not live. And what we are doing, how we are presenting them for them. So if I were, let's say, Tanner, whose BMI, I think, is probably 21, but if he wasn't 21, but if he was at the higher level, and if he needed help. So this is what I would like to be able to tell him. Okay, now, Tanner, you can actually go to our CHRIAS YouTube channel, and the playlist that we have for this specific series of events that we have from, like, they are 30 minutes average. So then if you start watching them, outside of what you do with our surgeons in those visits, with the nutritionists, with the other specialties, these events, these videos should be able to help you to understand the program really well. And today's event is volume 7 for the life after bariatric surgery in terms of maintaining the weight loss. So now from that, Dr. Irgau, why is it so difficult to maintain the weight after you lose some, and then now we have to maintain it? Why is it so difficult?
So conceptually, there are two important things to consider, Kemal. First is, what is obesity? Why is it so hard to lose weight in the first place? That's an important part to understand. And then the second part that we really need to understand is, what is the contribution of surgery? What does surgery do exactly? Okay, so let's tackle the first one. The very important misconception about obesity is that it's all about eating less and exercising more, right? We've been told about this equation of calorie in and calorie out, and then we expect results based on that understanding. Well, as it happens, it doesn't work that way. Many people struggle throughout their life to lose weight, pretty much adapting perfectly the system of calorie in and calorie out, and they don't see any results. Not only they don't lose the weight they want to lose, but they continue to increase their weight. Why? Because there are many factors involved in really determining why a person becomes obese and why another is not. It's not just about how you eat and how much you exercise. It's also fundamentally about the biology of that person. In other words, if that person's biology is geared to keeping them at a higher weight, everything that that person does will be geared by the body towards gaining weight. So it's going to be way easier for that person to gain weight and way harder for them to lose weight. In other words, from that body's perspective, gaining weight and losing weight are not treated equally. They are two different processes. It is a lot easier for that person to gain weight, and it's a lot harder for them to lose weight. That is a person who ends up having morbid obesity in the middle of their life after many years of struggles on ups and downs. So the biology is at the center of why a person is obese. And obviously there are other factors. There is no question how one eats and how much one exercises, what medications they are taking, whether they sleep enough or not. All those are important. But obesity itself is also a platform for further weight gain. In other words, once your body reaches a certain weight, it wants to defend that weight. It's almost as if you have some type of thermostat in your body, which sets the weight to a certain level. It says, okay, this person's body is going to be at 230 pounds, 250 pounds, or 300 pounds. And whatever that person does to change that situation, the body resists, right? So it's like having a thermostat in your house, whereby, you know, if you want the temperature to be at 68 degrees, you just change it, okay? If it's too hot, the air conditioner will come up. If it's too cold, the heating system will come up. Well, the body says, no, you cannot set it up yourself. The body, the biology sets it up. So no matter how little you eat, no matter how much you exercise, this weight is not going to move. I'm just going to change your metabolism so you are not going to lose weight. So that is what the person is fighting against, okay? That's why diets don't work. So surgery comes in to really change that. And it changes that by giving the person tools that fool the body into thinking that a lower body weight is more acceptable. That's why weight loss happens efficiently after weight loss surgery, whether it's sleeve gastrectomy, gastric bypass. These are metabolic procedures that really change some ways in which the body understands where the weight should be. Having said that, as I tell my patients, Kemal, these surgeries are not magic answers. They are tools, very powerful tools, but nevertheless tools. So the person has to understand is that if they give the body a little bit of way out by not eating right, by not exercising, the weight could come back and could come back with a vengeance sometimes, right? So that is why we have to prepare our patients to understand, look, surgery is not a magic answer. We're giving you a very powerful tool. So when you try to lose weight by yourself, by eating right, by exercising, we want you to continue that lifestyle. We're not saying stop doing those things and just have surgery. We're saying we're going to add surgery to those things so you can be successful in the long term. And most of our patients with this attitude stay with the weight loss.
Can you go back to this communication that we have, I guess, between the stomach and the brain, and how that those settings are, those adjustments are made, and then, if I'm understanding you correctly, so then the decision is done by the body, but then there are different organs, right? So is it the brain or is the stomach making that decision?
So it is a cooperation between the digestive system and the brain, mediated by very complicated messengers. That is important. And what we have found out is, by chance, it was actually a discovery, when we did surgery with a simplistic purpose of making the stomach smaller or avoiding digestion through a very powerful digestive area of the body, we were going to do mechanical changes. What we discovered is actually we were changing the way these messengers work, and that was beneficial. And that's why we're finding things like improvement in diabetes, in high blood pressure, almost sometimes independent of the weight loss, because we see that the surgeries themselves have become very important metabolic transformations in our body. That's why the surgery works. So there is definitely important connection between the digestive tract and our brain as far as determining metabolism and ultimately our weight. And surgery interferes with that in a beneficial way, but not in a complete way. Meaning that if a person, for instance, has had surgery, they've lost weight, they cannot eat enough, a lot, and they're not hungry very often, but for whatever reason, they start eating M&Ms or other high calorie dense things, well, the weight will come back. It will come back, right? So those things are a no-no, right? Now, how do we make sure that doesn't happen? First of all, is education, right? Upfront, we educate patients. But most importantly, the second is we provide support long-term. That's why we say, when you are a patient of CHRIAS, you are a patient for life. We see you after the surgery, frequently in the first year or two, but after that, we want to see you at least once a year for the rest of your life. And we want to see you when you start struggling. When you start struggling and see some weight coming back, when you start struggling and you've forgotten some of the teachings you had, don't say to yourself, oh, Dr. Irgau is going to be disappointed with me. I am feeling guilty, so I'm not going to go see him. That is the time I want to see my patient. That's precisely the time I want to see. Of course, I want to see my patients when they are successful and celebrate with them. But more importantly, I want to see them when they're struggling so I can provide that support based on the years of experience I've had, similarly with the other surgeons as well. So ongoing connection is very important, right? Very important. That's why it is important for our patients to know that this connection has to continue for the rest of their life, right? Again, surgery is not a magic answer, but it is an extremely powerful tool. It is the most powerful tool we have currently to combat morbid obesity. When somebody is struggling with 100, 150, 200 pounds of extra weight, it is going to be very hard for them to be successful without surgery. Surgery can be done safely, and it's a very powerful tool that can keep them successful long-term, provided they understand the teaching at the beginning, but they follow up with us also long-term.
Now, Dr. Irgau, with the,
Excuse me, yes.
As we are losing weight after the surgery, so certain comorbidities that we are improving, such as diabetes, sleep apnea, hypertension. Many patients, actually prior to today's event, one of our business development team members, Christiana, actually was just verifying the list of patients with their 12-month weight loss. And we are about 30 to 34% total BMI reduction from the time of the consult to the time of the 12-month follow-up. Yeah. So many of these patients are off medication. Now, as we are actually not taking certain medications, and now does that help the weight loss, maintaining the weight loss, or does it actually need another adjustment to keep it going?
So absolutely. So if patients are on medications, say for high blood pressure, for diabetes, as the weight loss occurs and as the metabolic power of the surgery start to work, there is much better control of blood sugar. There is improvement in blood pressure. So those medications will be too much for them because their blood sugar will drop, their blood pressure will also drop, and that's not good. So there has to be adjustment of those medications. This is beneficial. Some patients don't need the medications. Some patients will need less medications. Some patients will need no medication after a longer period of time compared to others. This is very individual. So it is important, not only they follow up with us, but they follow up with the primary care doctor as well, particularly patients who have diabetic, patients who have high blood pressure. I tell them, look, you're making your appointment with me for follow-up. Make sure you make an appointment with your doctor as well, because some adjustment of those medications to decrease them is going to be necessary, right? That happens. Now, in terms of whether there is an interference with the weight loss and the medications, there isn't, absolutely, as they are, controlling their blood sugar better, as they are eating healthier, as they are eating less, they feel better overall. And that by itself is even a stronger motivation for them to continue to follow what we tell them, right? There is nothing better for a patient than go to their doctors and their doctors to tell them, look, your blood work is pristine, it's great. That's what they want to hear. Once they hear that and they know they have enabled that by losing weight, they will continue with that course. What I find sometimes, Kemal, is that patients will go, for years with excellent health, with the weight loss completed or at a great position, but then maybe a crisis will hit them, whether it's a divorce, whether it's a loss of a job or something else that will really make them lose focus. And then during that loss of focus, the weight can creep back up, right? And once they realize that, their motivation actually can go down, right? Because they feel bad about it. Well, that's why we say we're here for you. That is the time when we will be your crutch. Come back to us, come back. This is your place to come back and seek support, to see the surgeon, to see the nutritionists that you have talked about. No judgment at all, because we know we're not dealing with a willpower issue only. We're dealing with a biology that is chronic, and a very long-term follow-up is necessary for patients to be liberated from this for the rest of their lives.
It's part of the reason, I guess, when we look at those follow-up ratios, like how many patients actually are showing up for their routine, like the 3 months, 6 months, 12 months, and one every year, I think maybe in some cases, patients are seeing that as like, oh, well, I'm still a patient of bariatric versus actually they're part of the program. Like what you were mentioning earlier, rather than looking at it from the patient standpoint, if they were to look at it as like, this is a wellness program after my surgery. So that probably psychologically helped, because I personally have talked to several patients while we are trying to set up the program, and I do actually pick up the phone in our case conferences and in some cases for some follow-ups. And I do see the issue of patients feeling like, I have done so much to get to this, and I got my surgery done, and I'm not going to do any more follow-up. I don't want to go back to doctor's office. Now, that actually brings up to the earlier slide that I shared with you guys. Our YouTube channel is the key. Those are free education. I know when we say education, there's a little pushback there, but these are extremely beneficial for, even if you don't have, if you are not qualified for bariatric, but how to actually prep yourself for that process, or how to avoid becoming morbidly obese. Those videos should be helping for understanding of the weight loss, understanding of the maintaining the weight. Now, one of the other things, Dr. Irgau, I want to share, and I was actually trying to get one of the live reports, and last time I did that, I got in trouble, so I'm just being careful. We are right now with the surgery center at American Surgery Center. We are at 100% patient satisfaction in the last 12 months.
Great. That's great.
This is our second, I believe, or the third month in a row that we have, we are 100%, and we are extremely proud of that. And but also we know that we are working so hard to get that number.
Absolutely.
And that's something that we are going to keep doing on a regular basis, and providing the service, not compromising in any way. So I actually, if I can share this, so that, like the live data is the best, as long as I can do it securely. So here is our patient satisfaction. So these are every week, every day, we are getting responses, but this is 100%. We don't have a single person in the last 12 months who were not happy with the services. Now, the building that relationship is extremely important with the team that we have. So I think understanding that this is a long-term, I believe that's going to help patients to know that they are no longer patients of ours, but they're part of our, like the member of our wellness program.
I like that. I like that very much, Kemal. I like the idea of not thinking themselves as playing the role of the sick person who goes to see the doctor, but as somebody who is part of a wellness program who has been empowered by a powerful tool with the surgery to overcome the obstacles of obesity. And now they follow up with the program to get more education, to advocate for other patients, to participate in support groups, but also to have some support when they are struggling. So this idea of the looking at it as being part of a wellness program actually is much more appealing, because psychologically, you're right. You go to the doctor when you're sick, and then if they have an appointment with a doctor, then they have to play the role of the sick person when they are not. You're absolutely right. I do like that idea of feeling part of the program and continuing to do so. But to just add a little bit to the issue of the long-term success, again, Kemal, it cannot be overemphasize the fact that really being part of a program and participating in the long term with that program with at least yearly visits is very, very important, right? It's important. And also, there is absolutely no judgment or shame if that person is struggling. I know many insurance companies stigmatize obesity to the extent that they say, okay, one bariatric surgery per life, or this and that, as if we're not dealing with a chronic disease. We're dealing with a chronic disease. It's very, very hard. So patients coming back, we have different tools for them to really get back on track, whether it's with counseling, whether it's with education, whether it's with medication. And yes, sometimes repeat surgery may be necessary to some extent for us to go and offer them a more powerful tool based on how they have done. But this assessment can happen only if we see the patients, in a long-term basis.
So, Dr. Irgau, we try to keep these events under 30 minutes, but then as I was just going through these different types of activities on different channels, the important part of is whether or not how important this topic is, not actually worry about how long it is, but how well it's covered. And we are kind of focusing on that and trying to make these as clear, as easily accessible to our patients. And I just want to make sure that we have a good understanding of the digital health, digital age that we live in. I mean, as you just saw my latest article on the communication, and which wasn't just the business, but also on the clinical side, how we are adapting. And I do want everyone to take advantage of these events, reach out to us. We are available. We are here to help. Our entire team from every level is trying to make this easier, more like a Ritz-Carlton of bariatric is what we are trying to do at American Surgery Center. I don't think Ritz-Carlton is going to worry about the copyright, but that's what we are trying to do. Regardless of your insurance, as long as we are participating with your insurance program, then you receive the top-notch service. In some settings, we know that patients become a number. Yeah. We know our patients by their first names. Yes. So we know what type of problems they're going through, what issues they have. And I can name 5, 6 different of our members here from our team that can tell you easily 10 patients who are going through the program. That's part of the, our daily case conference culture, but discipline, but also that's not ending there. So we'll be still involved with what patient needs to go through it, and we'll be still supporting you until this becomes part of your day-to-day life and just make it long-term, hopefully. Well, Dr. Irgau, thank you so much for joining us today. I know you have,
Thank you.
I mean, I keep saying this, but sometimes they don't really understand. I do steal you guys from your patient flow, and I really appreciate for you being available. And then we'll be back next week at 3 p.m. with another topic, and hopefully, and also we have another event from United Medical ACO on Friday for those who may be interested in that. A little bit different topic. State Senator Brian Townsend will be my guest. So hopefully I'll see you guys either there or next week on Wednesday at 3 p.m. Thank you so much. We'll see you soon. Bye-bye.
Yeah, thank you. Thank you. Stay safe, everybody.